Welcome back, everybody. This is a very important video. Something that I don't believe anybody, to my knowledge, has really been speaking about in terms of post-bariatric surgery. Now, this applies to anybody who has had a malabsorptive type of surgery. So this would be my Roux-en-Y folks and the duodenal switch folks, and maybe a small section of the gastric sleeve folks. So today I'm going to be talking about idiopathic postprandial syndrome, or IPS. So sometimes this is also known as reactive hypoglycemia or postprandial hypoglycemia, things of that nature. So one of the reasons why I want to talk about this is because right around a month ago, I started feeling a little bit different towards the afternoon hours of the day. The morning hours were normal for me or whatever, I felt fine. But right around 2 or 3 in the afternoon, I would sometimes start to have like hot flashes. And I would start to feel sweaty. I would stand up and I wouldn't feel like 100% my equilibrium was correct. Now sometimes when you have bariatric surgery, like that will happen right when you stand up. You have a little bit of wooziness because of iron levels and things of that nature, but I didn't really ever have it kind of sustain. And so I did some research. I went and had my blood panels done and everything was normal. Like iron was good, B12 was good, things of that nature. And so I was like, what the heck's going on? Like why do I feel this way? And then I got sick, with a head cold, flu, whatever. They gave me antibiotics and all that fun stuff. And then I was like, okay, well maybe that was just the reason I was just getting sick. And then lo and behold, like I still kind of had issues with those feelings, like just kind of feeling off, dizzy, a little clammy perhaps, and just not feeling too good. So I started doing my research and I found this idiopathic postprandial syndrome, IPS to be exact. And I'll have a link to a Healthline document down below. They are not a sponsor or anything like that, and just want to make sure you all know that. That is where I'm getting some of this information to report to you. But what I'm telling you is that this is a situation that makes you feel out of energy or shaky after you eat, after a meal. And so you might think you have low blood sugar or hypoglycemia. However, when they check your blood, which is what happened to me, they checked my blood and I had like a 94 glucose level, and so things will fall into the normal range. Other names for this could also be carbohydrate intolerance, which if you're a duodenal switch person, that probably is what's going on. Androgenic postprandial syndrome, and idiopathic reactive hypoglycemia. So IPS, because that's the idiopathic postprandial syndrome is what we're talking about today, differs from hypoglycemia in about 3 ways. So blood sugar levels in people with hypoglycemia are usually below 50 milligrams per deciliter, so mg/dl, whatever it may be. But people who have IPS may have blood sugar levels in the normal range. And so when they test you for that blood sugar level difference, you're going to show up like normal. You're not going to show up as anything's wrong. So if you're between 70 and 120, you still could have this. There's other issues if you're outside of those ranges, particularly if you're diabetic or anything like that. But that is something that I didn't know. So like when they're testing me, like, oh, everything looks fine. It's like, okay, that's fine. Hypoglycemia can lead to long-term damage of the nervous system and kidneys. But the good news is these conditions don't happen with IPS. So let me say that again. If you are hypoglycemic, it can lead to liver function damage and nervous system damage. But if it's IPS, these conditions don't necessarily happen with that. However, IPS can disrupt your daily living, but it doesn't lead to long-term damage. So like this slight dizziness that I'm feeling, or this like hot flashes that sometimes I'm feeling, It might be with me for the rest of my life. Is it inconvenient? Yeah. Is it make me feel a little bit less than whole in some ways? Yeah. But does it really stop me from functioning the way I need to function for the day? No. It just makes me feel a little bit off, and maybe that's just the way it is. IPS is more common than real hypoglycemia. Most people who experience fatigue or shakiness after a meal have IPS rather than clinical hypoglycemia. So that's not terrible, not good, but I mean, it is what it is. So let's talk about symptoms, okay? So what are the symptoms if you're in this boat? So if you're, 8+ months after a bariatric surgery and you're finding yourself thinking like, why am I shaky? Why am I feeling woozy? Why do I do this? So here's some symptoms that, I wish I had someone told me, but shakiness, nervousness, anxiety, sweating, chills, clamminess, irritability, impatience, confusion including delirium, like not knowing where things are, a rapid heart rate, okay, lightheadedness, dizziness, sometimes hunger. With us it's a little bit different because, of the reduced stomach size, we may not even feel that. Nausea, sleepiness, blurred or impaired vision. I know I experienced that one. Tingling or numbness in the lips or the tongue. Headaches. I had a lot of eye pain, like right behind here. Like I had a lot of eye pain. I thought it was just from the pressure of my head cold, but it apparently is part of this too. Weakness. I definitely felt that. Fatigue, anger, stubbornness, sadness, or lack of coordination. Now that's a lot of stuff. And I'm not saying that every time you're being stubborn that you have IPS. I'm just saying that all of these things kind of are exacerbated with this type of syndrome. And so with me not knowing that, knowing these things, I can be like, okay, now what can I do to help me function? So some of the good things, if you can call it good, the symptoms of IPS don't usually progress to seizures, comas, or brain damage, but these symptoms can occur with severe hypoglycemia. Additionally, people who have hypoglycemia may not have any notable symptoms in their daily life. So one thing, before I go on here, remember this is not a medical channel. I'm here for mostly entertainment value, but I do talk about some things. If you do have any questions about your health or any health concerns, always consult your physician. Do not just take the guy on YouTube's word for it. Go see your doctor, have them do your blood glucose level, and then see if IPS is something that might be something that's an issue with you if you are experiencing these kind of issues. Causes and risk factors. Researchers really don't know what causes IPS. Honestly, for us, I think we know what causes IPS because we had something that completely disrupted our entire way of processing food. So to me, there's a cause and effect already present. However, there are some things that they have linked to kind of contribute to the syndrome, especially in people who don't have diabetes. So a blood glucose level that is in the lower levels of the healthy range. So if you're at the 70s or 80s, that might be you. Eating foods with a high glycemic index, a higher blood glucose level that rapidly drops but stays within the healthy range. So if you start high and then you drop that you also feel that. An excess production of insulin from the pancreas, which can happen. I know in variations of this that also that is the cause of this because your pancreas is kind of working a little bit more because it's used to eating in a certain way or used to having food in a certain way, and then all of a sudden like you're eating a lot less or whatever, and it's still producing too much insulin. Illnesses that affect the renal system, which includes the kidneys, and a high consumption of alcohol. So the question that a lot of people have post-bariatric surgery is, can I drink alcohol? The answer is yes, you can, and which I have done, but a high consumption of alcohol, which honestly for us is a lot lower than other people, can also affect this. So once again, before I get into the treatment piece of this, please be mindful that your physician should be the one to treat you, not the random dude on YouTube that you're listening to. But once again, I'm bringing this up to you guys for awareness, and I think it's important because I wish I would have known this, because when I was first starting to feel these symptoms, I did the whole, I don't know if anybody's like me, but you'll go on WebMD and you always end up either having AIDS or cancer, because everything leads back to those two things. And so, don't do that. Don't freak yourself out over that kind of stuff. That's why I'm here to help. Okay, so there you go. So most people who have IPS don't necessarily need medical treatment, which is a good thing. Your healthcare provider may recommend that you modify your diet, gotta love that, to decrease your chances of developing low blood sugar. So a couple things that you can do right off the bat that can kind of help you out if you are experiencing some of these things. Eat high fiber foods such as green vegetables, fruits, whole grains, and legumes. I forget. Legumes. So whatever that is, I don't even know what those are. I need to look at what those are. Consume lean proteins from meat and non-meat sources such as chicken breast and lentils. Eat several small meals throughout the day with no more than 3 hours in between meals. That has been a big issue with me. I know that I've eaten I'll have a protein shake for breakfast, nothing for 5 hours, and then another protein shake, nothing for 3 or 4 hours. I'm doing it wrong. I can tell you right now that that's a big thing. So there you go. Avoid large meals. So when I would eat those pizzas, for example, I would sit there and I would eat the whole pizza over an hour and a half to a 2 hour thing. And mind you, they're not that big. They're this big and they're really thin. But I would just be snacking on it and just kind of slowly eat the whole thing. Not good. I should eat 2 or 3 slices of it, call it good for a couple hours, and then warm it back up, eat the next 2 or 3 slices. That one large meal is not exactly the way I should have been doing it. And that, honestly, and now that I think about it, this started happening after I started doing that consistently. So I need to get myself out of that. Eat foods that are high in healthy fats, such as avocados and olive oil. Avoid or limit foods and beverages that are high in sugars or refined carbohydrates, which for most of us already having post-bariatric surgery, that should already be a thing. So good job that we should, not have that be an issue. If you drink alcohol, avoid using soft drinks such as soda as mixers. Okay? Once again, post-bariatric surgery, we shouldn't even really be having that sugar to begin with, or that carbonation. So that shouldn't be really a huge issue, but I know some of you don't follow that. So tisk. Limit your intake of starchy foods such as potatoes, white rice, and corn. Corn. I went from flour tortillas to corn tortillas. My tortilla problems, man. The tortilla problems in life. I should make a whole other video about being Latino and having bariatric surgery. But the whole point is that the potato problem is a big problem for me. Starchy foods are a problem, and they're a vice of mine. And whether it be potato chips or other, I just can't give them up. Can't lose you. So if these dietary changes, don't provide relief, your healthcare provider might prescribe certain medications. Drug notice alpha glucosidase inhibitors might be particularly helpful. Healthcare providers typically use them to treat type 2 diabetes. However, the data on effectiveness of this medication treating IPS is very, very sparse. So Naya, I'm going to tell you right now, the most of it is going to be probably a dietary change or a lifestyle change, which corroborates most of the research that I have read around this syndrome and this issue. So just be mindful that this is something that is serious, but it's not as serious as having hypoglycemia and things like that. So once again, if you frequently lack energy after eating but have healthy blood sugar levels, talk to your healthcare provider about your symptoms and medical history. Working with your healthcare provider can help them identify a potential cause. So once again, I think we already know what your cause is, what the cause is. Your body is still changing. Just because you've had the surgery, over 8 months, doesn't mean that you're done having those kind of changes. Your body's still continuing to adjust even after that. So even if you're a year or two after, you could still have these issues come up. So I wanted to bring this to you guys' attention. I think that it's an important piece that not a lot of people have really brought up to the forefront when talking about bariatric surgery. The research I've shown that it does affect anybody or some people that have had malabsorptive type of surgery, so the duodenal switch and the traditional gastric bypass, Roux-en-Y, are probably the more common culprits of this, but it can happen to almost anybody, honestly. So even if you did not have the malabsorptive type of surgeries. So with that being said, I really hope that you enjoyed this video. Once again, this is not medical advice. I do recommend, if you do have any concerns regarding this kind of thing, to go see your healthcare provider immediately and get the doctor to actually give you some static advice instead of just listening to the guy on YouTube. But awareness is good. Entertainment's good. So there you go. So once again, thank you so much for watching this video. If this video was helpful or insightful in any way, please feel free to give me a like and subscribe if you're not already subscribed. And I will hopefully bring out some more issues, some things that might be that you should be aware of for bariatric surgery or post-bariatric surgery in the future. Once again, thanks for watching, and I will see you in the next video. Have a good one. Bye-bye.